So for those of you who do not know Beth Lovette, she is our new director, has been on board since about July.
Good morning. As Chairman Richardson mentioned, my name is Beth Lovette. I am the Health Director for Appalachian District Health Department and have been with the District Health Department since July. And I believe I came before this body on my first or second day of work to say hello. And so I feel a lot more confident this morning to be in front of you, having learned what a great organization that I work with. I've given you 3 handouts. One is our annual report. It's in the brochure format, and the extras are right here. I just want to, I'm not going to read it to you, but want to highlight a few things. On the inside of the brochure, it gives you some ideas of the type of district projects that we work with. One of them that I'm particularly proud and excited about is the Communities Putting Prevention to Work grant, which has been a wonderful grant from the Centers for Disease Control that has allowed us to work with folks here in Alleghany County, in the town, and the community to work on policy change and environmental change for healthy living. So that's been really exciting for me to get to know that. In my prior job down in Wilkes County, we did not have that grant, so what a treat it has been to learn about that. On the back page, where it says Promote, Prevent, Empower, you see some district-wide statistics, lots of big numbers. But I wanted to share some Alleghany numbers with you this morning. In the last fiscal year, we served 1,305 unduplicated patients in our clinical services area. Those patients received over 3,000 visits. In our health department, we do provide, in addition to the state-mandated services of women's and children's health, we also provide primary care for adults. And we served 391 patients in our primary care practice. Those are folks that use the health department as their doctor's office, basically, just to sum that up. Of those 391 patients, 60% of those are uninsured. So our target population is what we call the underserved in Alleghany County. And I'll just mention that the Appalachian District Health Department, Alleghany County Health Department, have made application both to Golden Leaf and to KB Reynolds for support of that primary care project, which is a piece of what we call the safety net for uninsured folks, underinsured and uninsured folks in Alleghany County. Of course, the hospital emergency department is also an area where those folks end up when they need care. In Alleghany County, environmental health folks reviewed 73 applications for new septic permits, 51 for new wells, 37 existing septic evaluations, and 24 existing well evaluations in the last fiscal year. And so that's just a summary of our annual report. We followed the format of our annual report that we had in years past, but I've got a goal for next year, and that is that in our district annual report, there'll be a little county supplement with much more detail for you to understand how your health department is working for you. At the moment, what we're working very hard on is serving our communities, making sure that we communicate well about the work we do, and making sure that customer service is top-notch, top on our list. And that takes me to the second handout that I brought, and it is the one that's looks like this, sideways, and kind of poorly copied. I did that. Sorry, you have to flip it over instead of the way you think it would work. But this is a message that's actually been developed by the Public Health Task Force in North Carolina. What do local health departments do for North Carolina? And I think it's important that we get this out to folks because just as my annual report highlighted, we tend to think in North Carolina about public health touching the people that walk into the health department or need to make an application for the health department, and we forget that your public health department serves the whole population of Alleghany County, and the work that we do to protect against illness, outbreaks, and disease, and to educate in the promotion of health and prevention of disease, and to promote community and economic health. We're told now that when businesses look to move into a community, they look at the high school graduation rate, and believe it or not, they are looking at obesity rates now. So that's a pretty significant change across the country, not just here in Alleghany County. But one of the troubling things for public health is that when we're really working well, you don't know about it because things don't happen. And just as an example, if your septic tank isn't failing, you're not concerned about it, right? If you're, if we have an active TB case in Alleghany County and we prevent the spread of that through treatment and aggressive follow-up, then you don't know about that either. And in fact, right now in North Carolina, parts of North Carolina, we have a pertussis outbreak, a whooping cough outbreak. And our job is to work closely with the medical community to make sure we get those pertussis boosters that we're finding that young people in North Carolina need now, so that we won't have a whooping cough outbreak in Alleghany County. So our successes are often quiet and hard to follow because of that. This North Carolina sheet can give you some additional examples of public health at work. And the last thing I really want to bring your attention to is kind of hot off the press, and at the last moment I printed it and brought it to you. And this is related to the Surgeon General's report that calls on North Carolina to make the next generation of North Carolinians tobacco-free. And there's a specific paragraph in here relating to Alleghany County, just to make you aware of it. Among the youth participating in our Alleghany County Youth Risk Behavioral Health Survey, that's 9 to 12th grade students, report the early use of cigarettes. Over 113 students, or enough to fill 4.5 school buses, reported use of cigarettes by the age of 17, with most starting at or before 13 years of age. And so, as a part of my public health lecture, if you will, I'll just remind this board that in our country, 400,000 people die every day related to tobacco, and 400,000 die. Yes, related to tobacco and tobacco use, and the next biggest cause of death is cardiovascular health related to poor nutrition and lack of physical activity. I'd be happy to entertain any questions you might have this morning about our annual report.
Questions or comments of Ms. Lovette? It is our honor that Ms. Lovette also serves as the president of the North Carolina Directors Association, which represents all the 100 counties in North Carolina. We should be extremely proud of that accomplishment. Any comments or questions?
Thank you very much for your time this morning.
Thank you.